We continue our series of 5 questions. In this third episode in the series, we'll take a look at questions from a variety of areas related to psychoanalysis. This discussion is not thematic, it's not based upon any particular school in psychoanalysis or any area in psychoanalysis. It is an eclectic collection of questions. Let us look at them. First question is, what is scam and dam? These two terms are not classical established academic psychoanalytic terms. I think you have seen my video somewhere. These are the terms that I have coined and I use all the time. Let us go into what they mean. Both of them refer to what is called affect mobilization. One of the ways of thinking about pathogenesis and healing in psychoanalysis is to think of centrality of affect. If we think of centrality of affect, then the idea comes up that it is the negative affect which is blocked in a complex, in a memory, in a psychological event, which is the root of the pathology. And therefore, to come out of the pathology, we need catharsis. Not only catharsis, but a fundamental restructuring also, so that the new negative affect does not build up. So the idea there is that if because of a traumatic event, negative affect has been blocked in that event in the unconscious mind, then two things have to be done for healing. One, remove through catharsis the accumulated negative affect. And two, ensure restructuring at such a fundamental level that a new buildup of affect does not happen. And this restructuring can happen because of many factors. It can happen because of something unconscious becoming conscious and being understood. It can happen because in that state of easy change, one decides to restructure oneself. Or for the first time, one realizes the real cost benefit analysis of what is going on and one decides to restructure. Or one sees the sheer self-destructiveness of irrationality of something and one restructures. Or one's aggressive drive has been satisfied and therefore one decides to restructure. And the restructuring is very important so that the new affect does not build up. So from that point of view, what becomes very important is how do you get the affect out in catharsis and how do you ensure that in repeated catharsis as it happens, somewhere restructuring happens so that the new affect does not build up. Now to do that, we have to use techniques which mobilize affect. If the affect remains completely unconscious, you can't do anything with that affect. You can't get it into catharsis. You can't get a restructuring done. So what you have to do is you have to somehow create a state where the affect can be mobilized. And the affect mobilization has two parts. If affect is mobilized in a way that the system can handle it constructively, that affect mobilization is good affect mobilization. But if too much of affect is generated, which is beyond the capability of the system to handle, then we say it is destructive affect mobilization. So we have two terms: constructive affect mobilization, which is right amount of affect mobilized at the right time after right amount of working on the defenses. So this is the constructive affect mobilization. And then there is a destructive affect mobilization, where you mobilize too much affect beyond the will and capacity of the system to utilize. And this can backfire. This can easily get into more severe self-damage, psychosomatic damage, leaving the therapy, fighting with the therapist, or a worst case scenario, a re-traumatization. So let us look at some more aspects related to constructive affect mobilization and destructive affect mobilization. We say some affect mobilization is constructive when the affect is moving into the striated muscles, usually the hands or legs. It is not creating anything like nausea or blurred vision or difficulty in thinking, split getting open, projections happening. Those kind of things are not there. So we say the affect is in the striated. It's a ISTDP term. There are other ways also of knowing if the affect is optimum, but let us use this word for a moment. That we know affect mobilization is constructive when the affect is in striated, when the state which is created in which the affect is mobilized is not a state the person does not want, and the state is optimum for change, and the state is such that overall the system is comfortable in that state. Constructive affect mobilization also happens when we are able to do catharsis of the mobilized affect, a useful catharsis. You can have affect mobilization in split, which will not serve any purpose, but here the catharsis serves a purpose. The person feels good, light, detoxed after this catharsis. And there is a possibility, and often it happens, a fundamental restructuring happens of the psyche so that new negative affect is not built up. And there is a fundamental change related to the traumatic event in the person. So this kind of affect mobilization is called constructive affect mobilization, which is the goal of most affect-oriented therapies, to do constructive affect mobilization for the sake of healing, and this is done primarily by two elements, catharsis and restructuring. There can be another kind of affect mobilization which can happen by mistake, mostly in over enthusiasm of the person or ignorance of the person, I mean the therapist. And this can happen when large quantity of affect is mobilized without the will of the person, or without the capacity of the person. There is a severe deficit of self-strength, as Kohut would say, or as Freud would say, capacity of the ego to manage the system in the face of such volume of affect. Or when the split is open, if the split is not closed and we keep generating affect, mobilizing affect, that also can be destructive. Or there has been a mirroring failure. This is not yet realized by those who are in affect oriented healing modalities, that mirroring failure also has to be addressed just as the split has to be addressed. The mirroring failure we are talking about is the cohesion mirroring, and we have talked before of cohesion mirroring, the 5 A's of cohesion mirroring. acknowledgement, attention, acceptance, affection, and admiration. The 5 A's of mirroring. And if there is a severe failure of this in the childhood, the first thing the system wants is to address this. And without addressing this mirroring failure, it is not possible to generate new constructive affect mobilization. And if we insist, we end up with destructive affect mobilization. And lastly, we don't understand the difference between powerlessness and helplessness. Helplessness as an assumed position can be a defense, but powerlessness is real. And this needs support. This does not need challenge. But therapists keep insisting, despite this powerlessness, on mobilizing affect, and that creates damn destructive affect mobilization. And I always say, damned if you dare. Because this will result either in the person leaving the therapy, or anxiety getting out of control, or in the worst case scenario, re-traumatizing the person. If you are dealing with psychosomatic symptoms, it will worsen the symptoms. And that worsening will not be healing aggravation, it will be a new worsening, unrelated to healing. Or it can be the consequences of the mirroring failure going even deeper into the unconscious. Or a feeling that only if I had got support from the therapist instead of challenge, I could have pulled it off. So this is where affect mobilization has to be carefully studied. It can be constructive, it can be destructive, and this always has difficult consequences. This has the real healing consequences. And very important element here is the element of creating a good state in which affect mobilization becomes more constructive, and to continuously monitor if it is in the optimum range. Second question, is the surreal everywhere? Yes, the surreal is everywhere, and a good example of that can be to take a research article from a scientific journal and show how even in the most scientific and logical and quantitatively based, empirically based writings, the surreal seeps in. And this shows us how fundamental the surreal is, how fundamental the aesthetic is, how fundamental the need to experience good affect is. The need to experience good affect and the way we are structured, we experience good affect mostly in the surreal. And therefore, the surreal is everywhere. It is only in exceptions we don't find it. As a rule, we find it. It is, of course, not there where you have the real, not Lacanian real, but the way I use the word real, which is something which has to do with pure logic or a necessary evil or something completely banal, devoid of any imagination. So the real that I talk about, the way I use the word real, is something which is empirical or something which is banal, devoid of any aesthetic, devoid of any imagination, or something which is only factual. We can also see the everywhere element of the surreal in the naming of astronomy telescopes. Even in scientific endeavors like naming of telescopes, In astronomy, we see how we spend hours and days finding the good name, which should have some surreal aspect to the name. Look at how surgical instruments are named, how often they are embellished with color and shape in terms of the holding elements. Look at how medicines are named and packaged, how they are advertised, how natural sites are named, packaged, and advertised. So we can see the surreal everywhere. And the surreal, if you try to compare to the pleasure drive, the pleasure drive is a larger term than the surreal. You can have pleasure even without the surreal, but most of the pleasure happens through the surreal. But this is a wider term. Pleasure is a wider term than the surreal. And the surreal need not necessarily, however, be only a subset of pleasure. Surreal is involved in pain also, both in giving pain and experiencing pain. So in that sense, there is surreal outside of pleasure. Aesthetics is woven at the very root of our thinking. So even when we think unknowingly, there is a dramatist in the unconscious. There is a aesthetic person in the unconscious. There is a surreal in the unconscious. And the poetry gets embedded in prose. And it takes deep and strong effort to really get pure prose out of our usual prose where poetry gets embedded into prose. So usually what we have is prose infused with poetry. To have pure poetry, we have to make an effort. To have pure prose, we have to make an effort. What is our natural default condition is prose infused with surreal poetry. The surreal is rewarded in society. Not only it is everywhere, it is sought out, it is respected, it is rewarded. Look at the entire art area, how much people pay for it. Look at the entire fashion area, how much people pay for it. The entire experience area, anything thematic, how much people pay for it. Anything embellished, how people pay for it. Even in case of pure logic and truth in the area of knowledge, austere truth interests a few. It is truth which is embellished with the surreal that people like to hear and speak about and know and feel. Austere, pure truth, very few people are interested in. Nobody is interested. In fact, in this case, few are interested. But in case of scientific facts, if you give me a book, boiling point of liquids, nobody is interested in the scientific facts. Nobody is interested in everyday banal conversations. So nobody is interested in these things. In banal conversation, I would make an exception. Some people may be interested, but pure scientific facts, nobody is interested in. Austere truth, few are interested in. Surreal, everyone is interested in. Question 3. is taste an under discussed element in psychoanalysis? Very true. In fact, most psychoanalysts don't even consider taste to be an important variable. But in terms of the psychic operation, taste is an extremely important element. It is inborn and it is fundamental to creating likes and dislikes, which goes on to create liking or disliking, moving on to anger. Taste is both cultivated and inborn, and there is no way we can discard something which is inborn, because even so early in childhood, and not only in infancy but even in childhood, children display a their different sense of taste when it comes to toys, when it comes to clothes, when it comes to food, when it comes to places to visit, even music, and they have an inborn innate element of taste. I can recollect the kind of songs I used to like. I would not know why I like them. I would not understand half of it, but the taste was there. I remember the type of clothes I used to like as a child. I had a very good taste. I could not understand why I had that taste, but I had it. So I feel this is a very important element, inborn, cultivated also, but largely inborn. We can talk of it in two ways: a horizontal aspect of taste, taste for various elements, which is largely cultivated, and a vertical element of taste, to of evaluating something as high or low, that is largely inborn. Of course, the cultivated elements are there. It is not solely inborn, but there is a very strong inborn element to it, innate element to it, constitutional element to it. This element of taste pervades everything: aesthetics, thoughts, behavior, living, public life, spirituality. We have some idea of our taste in every area of life. Taste also is a very important element, because how much is the difference in reality and desire, that gets determined not only by the distance, the objective distance between them, but by the subjective evaluation of that distance, and that evaluation involves taste. Very important element is, when we find something of our taste, we find ourselves at home, and often we find such group of people or such clothes or such surrounding very late in life. And when we find something of our taste, mostly a group of people, we find ourselves at home and we experience a very deep peace. And when we are not in a place where we find ourselves at home, there is a constant sense of agitation, some sense of discontentment. One of the very important elements, at least in later life, if not early, I would say, if not before 25, then definitely after 30 and 35, to live out one's taste and live out one's fantasy. This is a very important element of self-exploration. Fourth question: is using more than one school of psychoanalysis counterproductive? I don't think so. I think it is very productive. I think it is not only something one should do, it is something one must do. Not only it is necessary to use more than one school, it is an imperative to do so. And unknowingly, most therapists are already doing it, but most of them don't even know they are doing it. Take for example the idea of holding. Somebody comes in the first a few sessions, you don't interpret hard. Unknowingly, you're already practicing a cohesion technique. You may not have heard about code, but you are practicing cohesion holding. You see somebody into extreme thinking and you try to show the two extreme parts and ask him to put it together. You are already doing Kleinian concepts, even if you don't know Klein. If you ask somebody to look at evidence in reality against a false belief, you already are doing something from RABT-CBT. We have to recognize the limitation of each school and the strength of each school, and then put schools together for healing a person in the best way possible. Unfortunately, most therapists don't have knowledge of various schools, and this limitation does not allow them to use more schools. So one needs to have knowledge, and more importantly, after having knowledge of many schools, judgment of when to use what and how to synthesize different schools for any given case that you are working with. To create an integrated theory is even more difficult. We are all awaiting it. I have created one model git which can integrate different schools of psychoanalysis. Some more time and we'll have to see how it turns. But the prospects are there. We have to integrate not only, if not integrate, we have to use not only multiple schools in psychoanalysis, but schools from outside of psychoanalysis and schools even from Indian spirituality. In the next 10 to 15 years, we will see this synthesis happening. Synthesis between schools in psychoanalysis, synthesis between schools in psychoanalysis and schools outside of psychoanalysis, and synthesis of schools in psychoanalysis and schools of spirituality. So we are moving ahead into an area of synthesis. Question 5. Are the limits of human potential fundamentally different between the East and the West? Absolutely. Completely different. Let us look at some of the areas where they are different. First, let us look at who is more liberal and who is more conservative. West is conservative, East is liberal. West is pessimistic, East is optimistic with relation to limits of human potential. How far change in human being can go? How far can transformation go? East is very liberal, optimistic. West is conservative and pessimistic. Let us look at a few elements which illustrates this point. So these are the 5 points on which East says yes, West says no. East puts all of this as goals for any spiritual aspirant. West says these are simply not possible. So for West, all of these are outside the boundary of the human potential. But for the East, All of these are within the boundary of human potential. First, state of no thought. This is one of the very important elements in all spiritual schools in the East, that one can develop oneself so that one can enter the state of no thought on demand and be there for considerable amount of time, if not in perpetuity. And this is the end goal of many spiritual schools, and in some spiritual schools, this is the beginning. In Sri Aurobindo school, this is the beginning. In Osho Rajneesh, this is the end. Experiencing object-free states. When we have a state of no thought, we experience an object-free state, which is not possible in the Western conceptualization, except in Freud, who talks about state of primary narcissism, which is a pre-object state. But most schools now don't believe that it exists. And the limitation there is, Freud talks of an object-free state only as an oceanic state, but it does not talk of an object-free state, which is a non-oceanic state. And we are talking here of experiencing an object-free state, which is non-oceanic, which is quite given in the East, not possible in the Western conceptualization. Experiencing pure affect, which neither has an object outside, nor is it coming towards some object inside, but you can experience it as an object-free pure affect. I have myself experienced all the three, and so I'm very convinced about it that the East is correct on this aspect. Freedom from desire. There is a spelling mistake here. In the Western scheme of things, this is not possible. In the Eastern scheme of things, this is the goal of spiritual schools. Oceanic oneness with existence. Again, one of the goals and very natural possibility for spiritual schools of the East, not possible for the Western psychotherapy schools, except for one exception, the oceanic oneness that Freud talks about as a pre-object state. But this oceanic oneness is of an adult, which happens after years of self-development. This is not referring to the pre-object state. This is something that you develop after you move from the pre-object stage to the object stage and then to the post-object stage. So this is a post-object state. This is not a pre-object state. So this is very different from childhood oceanic oneness of primary narcissism. This is a sign of very high development. This is not infantile at all. Possibility of suprahuman evolution in terms of developing powers which are suprahuman, or transformation of the body and mind into something suprahuman. Easily accepted in the East, not accepted in the West. So the limits of human potential are very liberal in the East. East is very positive and optimistic. Left is very conservative and pessimistic. Next 10 years will by and large prove in experimental setups that much of this is true. We conclude with this third episode of 5 questions. Once I get 5 more interesting questions, I'll come back with the 4th episode. If you have any questions, write to me. Till then, let's conclude for the day. Thank you for being here.